What is the best form of hormone replacement therapy? Once in a while, a patient will ask me, what do you think is the best form of hormone replacement? My answer is twofold. It's not what I think is the best form of hormone replacement. It's what is the best form of hormone replacement based on the evidence. And secondly, it's not what I think is the best form of hormone replacement. It's what patients feel is the best form of hormone replacement based on their experience. So let's talk a little bit about each form of hormone replacement. Let's start with pills. If your practitioner prescribes oral testosterone or estrogen, you need to run because your practitioner does not understand how hormones work. When testosterone or estrogen go through the mouth, they go into the intestines, they are absorbed into the portal vein. From there, they go to the liver. This is called first pass metabolism. The liver chews them up and creates inflammatory chemicals that increase risk of disease, including heart attacks and generalized inflammation. These two hormones were not designed to go through the mouth. By contrast, progesterone can go through the mouth, and we want it to. That is the most effective route of administration for progesterone and provides the greatest benefits. Second, let's talk about troches. Troches are a good idea in theory, but practitioners who prescribe troches do not understand hormones. Let me explain. The idea of a troche is that you put it in your mouth under your tongue and then you let it dissolve. And whichever hormones are put into it are then absorbed directly into the bloodstream through blood vessels under your tongue. But there's a problem with this. Every patient I've ever met who came from another practitioner who prescribed troches, whenever I asked, do you swallow your saliva after putting that troche in your mouth? Every single person has to admit yes, because it's not all absorbed under the tongue. So where's it going? It's going into the intestines, into the portal vein, into the liver, first pass metabolism, inflammatory chemicals. Bingo, not good. This is not acceptable. Okay, let's talk about shots. A lot of men in particular are prescribed shots. Taking a hormone like testosterone through a shot is like opening up a bank account and putting $10,000 in the account and then going to your bank the next day and asking for $100. And the teller says, I'm sorry, I can give you $10,000 or I can give you $0, but I cannot give you $100. This is because when you inject the testosterone into your muscle, that testosterone is immediately available to the entire body. It rapidly distributes into the bloodstream. And so the entire dose of the testosterone is in your bloodstream within 24 hours. And then your body is metabolizing it. And so it is decreasing rapidly. And within a few days, it starts to wear off. If you catch it in time by injecting again, then you can avoid your level dropping too low. But then, of course, you have to be careful with your dose because you can take it too high. Basically, what you're doing is taking your testosterone level in your bloodstream like this and down, this and down, up and down. This is not a physiologic manner for hormone delivery. And most people who use shots can feel the extremes of the highs and the lows, and it happens every week. Moreover, there has been some evidence that testosterone injected directly into muscle increases risk of spasm of the coronary arteries. Not the best thing. Obviously, it's not a huge risk, but it has happened. Next, let's talk about gels and creams. The idea of gels and creams is that it's simple to do. You just apply it to your skin once a day or twice a day, and it gets absorbed into your system. This is a very common form of hormone replacement, and for many people it works just fine. However, it's not uncommon at all for me to find patients who have come from other practitioners who do not understand hormones. And so they start out with one dose, and then they check your blood after a month or so, and then they see that your hormone levels aren't high enough. Imagine that. And so then they increase the dose, and then they keep increasing the dose until you're on a ridiculously high amount of hormones, far more than your body would ever produce, all with the objective of getting your blood levels just right. There's a problem with this. Hormones that are delivered transdermally, meaning through the skin, do not concentrate in venous blood. As a result, in order to get your venous blood levels to the optimal levels, you have to take a massive overdose. I've seen women having been put on as much as 900 milligrams of progesterone a night, just trying to get their progesterone levels high enough to make their practitioners satisfied. But in particular, progesterone is quickly metabolized. And progesterone, because it's taken at night, you would have to test your levels 2 hours later. And I don't know too many laboratories that are open at midnight. So when a woman goes into the laboratory in the morning, say 10 or 12 hours after she took her progesterone, nearly all of her progesterone is gone. Now, all of the progesterone metabolites, these are what progesterone was converted into in the body, those are all there and they're active and they're doing what we want them to. But we don't have good tests for those metabolites. So we're testing progesterone levels at a time when we know, because of pharmacokinetic studies, that the progesterone that you took at nighttime, at bedtime, is long gone. And so you're just chasing your tail trying to get your levels up in a very non-physiologic manner. Estradiol and testosterone are different when you are applying those through cream because those don't have the extensive metabolism that progesterone does. But you're still trying to measure them in venous blood where they don't concentrate. If your preferred method of hormone replacement is cream or gel, then if you're going to test to find the appropriate dosing, you're going to need to use capillary blood spot, that's a finger prick test, or urine testing. Those are the most accurate means of testing cream or gel delivered hormones. With that said, I have had many patients who have been receiving pellets for a number of years and then gone out of the country for 18 months and not been able to get pellets during that time. So to tide them over, I prescribed cream that they could take with them or have shipped to them so they have some hormone replacement while they're gone. Almost invariably upon their return, they are begging me for their pellets back because they do not feel nearly as good on creams as they do pellets. Obviously, this isn't the case for everyone, and some people do just fine on creams, and they're very happy with them, and I wouldn't take them away from them because it is a safe method. It's just not as predictable because keep in mind, your absorption of testosterone and estradiol through pellets is 100% because it's under your skin and it's absorbed directly into your bloodstream in a depot form, which I will get to in a minute. But creams, the absorption is dependent on a number of factors, like for example, how thick your skin is in that area that you apply it. How porous is it? Are you sweating? How much fat is beneath your skin where you've applied it? And then of course, you have the concern about transference. If anyone or animal touches you on the area where you applied it, then you are giving hormones to that person or animal that they may not need, that may not be appropriate for them. Also, when you use up the hormones from the cream for the day, it's gone. This is why smart practitioners who prescribe creams will prescribe them twice a day. Granted, it's more of a nuisance for the patient, but it is more physiologic because your hormones are going to be running out within a number of hours because they do not last all day. And keep in mind too, whether it's a shot, a cream, a troche, a pill, you're getting the same dose every time. Pellets don't work that way. Let's say that you go to the bank and deposit your $10,000 in the bank, and then tomorrow you say, I want $100, and the teller gives you $100. Let's say you go the following day and you need $400. The teller gives you $400. Let's say the following day you only need $10, and so you get $10. As long as you've got money in that account, you can get whatever amount out each day that you need. With pellets, because the delivery of hormone is in a depot format, meaning these are solid hormone pellets. So this is a wad under your skin. It's a bank account, and your body will take from it what it needs each day. The amount that is taken depends on blood flow, and blood flow is determined by stress. What kinds of stress are there? There's physical, mental, and emotional stress. So if you are under emotional stress, you will need more testosterone, just like you need more cortisol. Thankfully, you have a big bank account full of testosterone that you can draw upon when you need more of it. Let's say you're sick. Guess what you need more of? Testosterone. Let's say you are injured or have surgery. You need more testosterone. Because you have this bank account full of testosterone under your skin, your body will take as much as it needs on any given day, every minute of the day. When you don't need much, such as when you're sleeping, you won't take much. When you're working out or under any of these other stressors that I mentioned, then you will need more and can take more. There is no other form of hormone replacement that provides this flexibility. There is also no other form of hormone replacement that provides this physiologic level of delivery, providing every cell in your body the hormones that it needs on a continuous basis. Keep in mind, why do we need hormones? It's not just energy. It's not just mood. It's not just endurance. Physical strength, sex drive, sexual pleasure. Bioidentical hormones have been proven, whether they're your own or you take them in a healthy form, to reduce all kinds of inflammatory diseases, heart disease, stroke, Alzheimer's, diabetes, osteoporosis, arthritis, breast cancer in women, prostate cancer in men, and so many other diseases. You don't want your cells to be hormone deficient. With testosterone and estradiol pellets, you don't have to worry about that happening. And we can also monitor your progress as needed with blood tests, because hormones delivered subcutaneously through pellets are measured accurately in venous blood. So for all the reasons I have just mentioned, the overwhelming majority of people we have ever encountered have found testosterone and estradiol pellets to be the most effective and most convenient form of hormone replacement therapy. And yes, we have many patients who would rather die than stop getting hormone pellets. The statements in this video are based on personal experience and the medical literature. Because hormone pellets are not drugs approved by the U.S. Food and Drug Administration, they are not allowed to diagnose, prevent, treat, or cure any disease.